The COVID dashboard is updated regularly. It's a valuable tool for our partners in the community, within the healthcare system, the municipalities, to see what the trends are in their particular areas. So I want to walk you through some of the numbers that maybe you may find when you look at it today. So you're going to see active cases that are well in the 400s. We have 418 active cases. Of those, 80 are from the Marist cluster, 38 from Fishkill Rehab, and 7 from DPW in Poughkeepsie City. And these take up a sizable chunk of the active cases, but they don't tell the whole story, which is that there's community transmission and people are becoming lax with some of the mitigation strategies that they have held to for quite some time. The governor's office, as well as the New York State Department of Health, has put new restrictions out there. And so individuals, if they are going to places like bars, restaurants, and gyms, will find that these establishments will close at 10 o'clock. And they're also restricting home gatherings or family gatherings to about 10. Why these are put in place, we know that, again, what is driving case rates are these type of events that are causing the uptick. The rise in cases may give people some trepidation and some fear, but some of this was expected in spring. We knew that fall, especially with regard to flu or any respiratory viruses, you would see a resurgence. And so what I want people to understand is that we know a lot more about COVID now than we did before. We know the steps that can be taken effectively to prevent COVID transmission, not only within the family setting, but also in the community setting. And so what I would implore people to think about is those things that you've done in the spring and summer to keep you healthy, and to double down on those steps to keep you healthy. All these rises and clusters are to be expected in this period of time, but it's nothing to be afraid of. We just have to be totally diligent in terms of the measures and the behaviors we are engaged in, not only to protect ourselves, but the community.